Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Tracy, a new Mayo Clinic study, there are lots of them that are coming out all the time, but a new one is found, and this is so interesting. More than 1 in 5 patients who were referred for a second opinion may have been incorrectly diagnosed by their healthcare provider.
Wow.
The study looked at medical records of nearly 300 patients and found that about 20% of the time, the final diagnosis was completely different from the original diagnosis.
Oh my goodness. Here to discuss the findings and the importance of a second opinion is the lead author of the study, Dr. James Naessens. Dr. Naessens is a researcher with the Robert D. and Patricia E. Kern Center for the Science of Healthcare Delivery at Mayo Clinic. Welcome to the program, Dr. Naessens.
Thank you.
Dr. Naessens, nice to meet you. Nice to have you on the program. So tell us about the study and what prompted you to do it.
Okay. Well, first, a few of my clinical colleagues came to me with a study where they were comparing the referrals from primary care physicians to primary care nurse practitioners and physician assistants. And they were really looking at the quality of those referrals in terms of what the content was it appropriate, things like this. And they asked, because they knew I was a health services researcher and had worked with them in the past, if we could help them out with some measures of complexity of the patients. So I said, I'll do something for you if you do something for me. And we've been looking at value of particular care within Mayo, within the center, for a number of years. And one of the things that we really didn't have much information on was how often do we change a diagnosis? What is that value of a second opinion? And so we asked them, could you review what the initial presenting problems were, what did the patient come with, and what was our final diagnosis? And how often do we change those? And how often do we potentially change the direction that the patient goes? So they did their study, basically comparing those quality outcomes and how good the referrals were. And then they looked at our information. Both of the clinicians reviewed every case and kind of determined which of the 3 buckets did that patient fall into. Was it a case where we just reconfirmed what the problem came with? Was it something where the patient came with a complex of symptoms and we further worked it out and figured out what the problem was? Or did the patient come with one issue and we basically said, no, you have a different problem. This is where you should go. And so we got that information back. We did see that among those primary care provider referrers, that the nurse practitioner, physician's assistants, and the physicians didn't differ. So that was another interesting thing, that the change in diagnosis occurred the same rates across the 2 groups.
Showing the value of those nurse practitioners and the PAs.
This is true.
Did the results surprise you?
The results did. We've seen some previous literature that basically looked at provider at patient referrals and at some of the e-consult referrals. And in most of those cases,
explain what an e-consult is.
Okay. So rather than having the patient come for a second opinion in what's going on, you basically have a specialist or another group of physicians review the medical records and some of the lab results and some of the x-rays. And without seeing the patient, they make a determination, is that initial diagnosis correct or not? And there are big programs, including some of our own, where a patient can turn to these people, provide them with their information, and get a second opinion.
Yeah, fabulous program. Sorry, go ahead.
But in those cases, it's usually around 10% of the time that there actually might be a change in diagnosis. So I was surprised by the extent of change that we saw.
20% of the time, 1 out of 5 people that you reviewed had their diagnosis changed when they came to the Mayo Clinic.
Yes.
Is there a certain condition that was the most often misdiagnosed?
That was interesting, too, in that we did try to categorize each of these problems into diseases and body systems and things like this. And the rates were across the board. There was nothing that really had that concentration.
Do you have you followed up to know what the consequences were, or do you suspect that the treatment was were these radically different diagnoses? I guess is what I'm trying to get at. So that if they had been treated for condition A as they were originally diagnosed, the treatment would have differed markedly from what they were ultimately diagnosed with.
So there were some, one of the limitations of our study was that we did not do the follow-up on the patients.
Okay.
So we didn't actually see what happened, but we did have the patient here in person. The Mayo team, which was a team of specialists, did further tests. They did further consults to get specialists. And so we clearly brought more resources to the table to evaluate those problems are. Can't say that we were absolutely right. The original diagnosis was absolutely wrong, but we have reason to believe that we were probably more likely correct than the original one. And there were some instances where there were major changes in that, where if you would have gotten treatment for the first problem, it could have caused more problems. It could have not addressed what your underlying issues were.
Would your study suggest, and do you now suggest, that virtually everybody get a second opinion no matter what they've been diagnosed with?
That's one of the conclusions that some of the headlines on the article kind of addressing it have suggested, and we say no. It's not 20% of the time that you go visit a primary care provider that they're going to be wrong. These were clearly patients who were referred by the provider. So the provider either had some reason to believe that they wanted a second opinion, they weren't certain what was going on, or the patient wanted a second opinion and the provider agreed to help facilitate that issue.
I will say from the standpoint of surgery, I think it's always a good idea to get a second opinion. It's that's a little bit different, but in fact, I always encourage it in my patients. If there's some question in their mind about whether or not it's the right thing to do, I think before you have any surgery, particularly spine surgery, getting a second opinion is a great idea.
This is very true. And one of my colleagues in the general field, Dr. Mark Graber, had kind of initiated this effort of diagnostic error a number of years ago, and he's president of the Association of Diagnostic Error. And he was actually asked about our study, and he quoted that there were probably about 2 or 3 conditions that clearly merited that a patient should get a second opinion. It's something very serious, something that would require invasive treatments. If you've been diagnosed and started to treat with a medical regimen and you're not responding as you're expected to retreat, or if the provider clearly has some ideas that they're not comfortable in making that conclusion and they want to seek out second opinions.
Wow, great study, well done, and I'm so glad that you were here to share the information with us. And in a lot of instances, just as you have outlined, a second opinion is a good idea.
This is true. Yeah.
Professor of Health Services Research, College of Medicine, Dr. James Naessens, thanks so much for being with us.
Thank you for having me.